In Jamaica, the Health Ministry has taken a proactive approach in mitigating a possible outbreak of the Zika virus. Health Minister Horace Daly says the government has stepped up its vector control and public education campaigns, but he says citizens also have a role to play. More from Leslie Ann Sherwood.
Health Minister Horace Daly says the government isn't taking any chances with the mosquito-borne disease Zika. According to Mr. Daly, it's not a matter of if, but simply when the disease will arrive on the country's shores. Approximately 19 countries have been affected by the Zika virus, including Caribbean neighbors Barbados, Guyana, and Haiti. Other countries with the virus, including Suriname, Colombia, Brazil, Panama, and Mexico, conduct business with Jamaicans on a regular basis and have several Jamaicans passing through their ports. Permanent Secretary in the Ministry of Health, Dr. Kevin Harvey, says the ministry has stepped up its surveillance at ports of entry.
We also would have installed at the airports the fever scanners that are there now that can help us to detect persons coming in with high fevers. But the challenge we have is that the majority of persons who will come in to the island infected with this virus will not be detectable at the port. The incubation period is between 3 and 12 days, and therefore you could be perfectly well traveling from any of these countries into Jamaica and then get sick later on. So the surveillance at the ports of entry is not our main means of prevention.
Health Minister Horace Daly says the ministry is partnering with schools, the private sector, churches and the media to get the message out to civilians to protect themselves against Zika. He says while the government has stepped up its vector control program, which sees ongoing fogging exercises, citizens sometimes shirk their responsibility.
The greatest risk we have is that our people don't take the precaution. You don't empty your vases, you don't inspect your homes, you don't inspect your restaurant, you don't inspect the school. Everybody has a responsibility to do their part. We have deployed hundreds of workers to communities to assist with identifying and destroying the breeding sites, and we have intensified our public education to our householders. We have been meeting with several groups to provide information in various forms. Our partnership with the Ministry of Education has seen training of our administrators, teachers, and students to provide them with information that they can bring back to their school community.
Meanwhile, medical entomologist Mrs. Shireen Huntley-Jones explains that the Aedes aegypti mosquito, which spreads Zika, hides within homes and sometimes fogging can be ineffective if citizens refuse to open their windows and doors.
We do have the problem, as our permanent secretary said, that this mosquito rests on the inside. And so even though the teams will be fogging, persons do not often heed or request to open their windows and doors, so to allow the fog to drift in. And because this mosquito is on the inside, then you can understand if the mosquito is on the inside and the fog is not getting on the inside, then we're not going to be able to get to the population. So the chemicals are effective, but the process of fogging may be affected because of the issue of that. Mosquito is on the inside and persons do not necessarily all the time open their windows.
She's assuring citizens that the chemicals used in the vector control program are safe.
Indeed, the chemicals are safe. The ministry uses the chemicals as per the manufacturer's recommendation. So the chemicals are safe. Before we go into a community, the ministry has what we do announce that we will be coming in, and we ask persons that do have respiratory illnesses to take certain actions, for example, covering their nose with a wet rag, or not to be present in the area that is going to be fogged. But the chemicals are safe because we use them as per the manufacturer's recommendation.
I'm Leslie Ann Sherwood for CEEN Caribbean News.
Meanwhile, Chief Medical Officer in the Health Ministry, Dr. Marian Bullock-Ducasse, highlighted some of the symptoms of the Zika virus. Dr. Bullock-Ducasse says one of the distinct symptoms of Zika is redness of the eyes, as well as headaches and joint pains.
Zika fever or Zika virus infection is a disease, as we know, that is caused by the Zika virus, and the main symptoms that persons get are fever or rash, that's a fine rash all over the body, starting on the upper part of the body. There's also headache and redness of the eyes. This redness is distinct from others in that there is no other material that you might see coming out of the eye, as in pink eye, so the eyes are just red. In addition, there's also joint pain, muscle pains. There can be swelling of the feet and hands as well occasionally. Of note is the fact that it is only 1 in 4 persons who become infected with this Zika virus that actually become ill. So the majority of persons who are infected with the virus do not even know that they have it because they develop no signs or symptoms. However, they are still able to pass it on if an Aedes aegypti mosquito bites them, and then they go on to become infected. In addition to the signs and symptoms I've just mentioned, we spoke already about the microcephaly, or the babies being born with heads that are smaller than normal and underdevelopment of the brain. Some persons can also exhibit other what we call neurological signs and symptoms, meaning that they could have some weakness, and some of it can go on to even extend in severe cases that they might not be able to use their limbs at all for varying periods of time.
And the Health Ministry is working to ensure citizens will be able to access medication if they become infected by the Zika virus.
The public is advised to utilize for the various signs and symptoms paracetamol or acetaminophen. As we have said for other of these viral conditions, the public is not to utilize aspirin or other anti-inflammatory drugs that they normally use, because these can cause complications which could be bleeding. Because of the difficulty with the early diagnosis, it could be dengue. So we don't want persons to have any unnecessary complications. The ministry has ensured that there are adequate supplies in stock of these items, and out of an abundance of caution, we're also ordering additional supplies. So it is a paracetamol or acetaminophen, which is available at all of the health facilities island-wide. We're also partnering with the private sector to ensure that in the private pharmacies that the medication will also be available.